Hello, I'm Ray Stevenson, reporting to you from Wakeman Hospital in Raleigh, North Carolina. We're here today to talk with experts about the recent outbreak and the disease known as Palsy syndrome. We're joined today by Dr. Stefan Emanuel, who's treated over 500 patients for the disease in the past month. Good morning.
Good morning.
So, could you tell us a little bit of background information on the disease?
Sure, Ray. Palsy syndrome is a blood-borne bacterial disease that causes numbness in the limbs or organs that can lead to permanent paralysis in those areas. The disease is highly contagious and goes into effect within 2 days of a patient contracting it. Since the beginning of the outbreak in June, we have seen approximately 10 million cases worldwide.
And where did this pandemic first begin?
The disease was first contracted in a small town in Colombia, and then carried to the United States through travel.
And where have numbers been highest in terms of location?
The most contracted areas are in South and Central America, particularly in poor and highly populated cities.
This may be the case, but Americans are affected by the disease as well. Today we're joined by Owen Boyce, whose sister, Rachel, started contracting the disease yesterday. Good morning.
Good morning.
So your sister, Rachel, who's 15, started feeling numbness in her limbs yesterday, is that correct?
Yeah, her fingertips, she complained that her fingertips were feeling numb and she's running a high fever.
And did she go to the doctor for this?
Yeah, the doctor gave her some antibiotics, but there's no guarantee that it'll work.
So do you have any ideas about how she could have been infected?
She was outside a lot, so I guess a mosquito.
And because you're living with a victim of the disease, do you feel at more risk of contracting?
Not really. I mean, like, the world is full of disease, so I don't really feel like any more threatened. But we're just rooting for Rachel.
Well, thanks for being on the show, Owen.
Cool.
Speaking of the disease spreading, we would like to talk to Dr. Emanuel about how the disease can be contracted. So, how is this disease most commonly transmitted?
Well, Ray, palsy syndrome is a blood-borne illness, which means that it can be spread through the transfer of bodily fluids. That means that it can be spread through blood, semen, saliva, or any other bodily fluid containing blood. Some of the most common ways the disease is transmitted are through unprotected sex, mosquito bites, and hypothermic needles. It's also important to remember that the bacteria can enter your body through any kind of open wound. Even sharing food can spread the bacteria through your saliva.
Well, that sounds really easy to catch. So what are some ways that we can prevent ourselves from being subject to the disease?
Basically, you just want to minimize your contact with bodily fluids. This means it's important that you are never in contact with another person's blood. If, for any reason, this gets on you, you should clean it as soon as possible and make sure it doesn't enter your body. Remember, it is extremely important that if you are sexually active, using condoms will help prevent the spread of disease. Other forms of contraception may prevent pregnancy, but cannot protect you from infection. This being said, avoiding sexual activity with someone who could be subject to the infection would be prudent. Spread through mosquito bite is pretty hard to contain, but staying out of outside areas where mosquitoes and ticks are abundant will lower your risk of getting palsy syndrome. Mosquito nets can also be purchased to avoid insect bites. Sharing hypodermic needles and using unsterilized hypodermic needles should also be avoided at all costs.
So we know how to stay away from getting the disease, but how should we prevent spreading it to other people?
Probably the easiest way to accidentally give someone the disease is through saliva. Make sure that you're always covering your mouth when you cough or sneeze. If someone breathes in the bacteria, they can be infected. Also, sharing food and drinks is a really easy way to spread this to other people. Try and keep your food to yourself, especially if you're showing signs of the disease. Once again, if you're bleeding, it is important that the area is covered in order to prevent others from picking up this bacteria.
Well, thank you, Dr. Emanuel. We'll try to keep this in mind over the next few weeks.
Thank you, Ray. Stay safe out there, everyone.
So, this has been Ray Stevenson talking to experts about the outbreak in Palsy syndrome. So, just remember that over the next few weeks, it is very likely that you will come into contact with this disease. So, try to keep safe, use our tips, and have a great day.